Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and developer of the addiction-free pain management system. According to the Institute of Medicine, there's over 100 million people living with chronic pain in the United States today, and we're spending over $600 billion in pain management and lost productivity. We all need to pitch in and make a difference here so we can help resolve this problem. One of the things I know that people living with chronic pain also experience other coexisting problems, including depression, anxiety, sleep, and even addiction problems. It takes a team because one of the #1 causes for failed chronic pain management is our failure as treatment providers to accurately diagnose and treat co-occurring disorders. The other major problem is family system problem. Sometimes the person has people in their family that are overdoing and enabling them. Other times, a lot of people living with a loved one with chronic pain becomes burned out, frustrated, and resentful. And then there's us as healthcare providers. A lot of times we don't take people's pain seriously. We don't meet them where they're at. We don't believe their pain can possibly be as bad as they're saying it. We give them the message, oh, you're faking it, or it's all in your head. And then the other obstacle is the patient's self-defeating reactions. The big one is if they do have coexisting problems, including addiction, there's a lot of resistance and denial. They believe that if I just get the right pill, the right procedure, or the right surgery, my pain will be fixed. But if they don't deal with the co-occurring problems, their pain won't be fixed. It'll just get worse. A lot of people also believe that all they need is to take medications. They don't do the non-pharmacological or holistic interventions, and most importantly, they don't deal with the psychological, emotional components of the pain. I have a series of trainings coming up this year in my office in Sacramento. Some of them are for addiction professionals, some of them are for multidisciplinary teams who are working with people with chronic pain and coexisting disorders. That was my doctoral dissertation, Managing Pain and Coexisting Addictive Disorders. I took that and turned it into another book, Managing Pain and Coexisting Disorders, because it wasn't really helpful to only include addiction as one of the co-occurring disorders. We need to look at the whole person. We need to look at lifestyle problems, their psychosocial functioning. Do they have depression? Do they have a sleep disorder? Do they have an anxiety disorder? Unresolved trauma history? Do they have good social support? All those factors are crucial in developing an effective integrated pain management plan that all the best practice principles call for when people are living with chronic pain. Unfortunately, many people living with chronic pain are just giving mono treatment, and what I mean by that, they're just prescribed pain medications. They're usually prescribed opiates and/or benzodiazepines. Unfortunately, we have no research on the long-term effect of using opiates for chronic pain. What we have been finding in the last few years is people that are on opiate medications for long periods of time, 6 months or longer, often develop a condition called opiate-induced hyperalgesia. And real simply, that means they are hypersensitive to pain signals because of the way the opiates change their pain system. We need to help people. We need to help people stop suffering with their pain now. I believe that freedom from suffering is a right. I also believe it's a responsibility. As a healthcare provider, it's my responsibility to look at the whole person and meet them where they're at. I believe my patients need to be active participants in their own healing process. That's their responsibility. And together, we can make a difference. I'm conducting a series of trainings in my Sacramento office this year. Some of them are for people living with pain or in recovery from addictive disorders and don't want to relapse. Others are for treatment providers who are working with people with addiction, mental health, or people who are working with people living with chronic pain. Check out the link below this YouTube video and join me at one of my trainings this year. I also, on our calendar, are places I'm presenting around the United States. I would love to have you visit, and please make sure to check out this information and make a difference in your clients' lives. Thank you.